So today, one might ask, if prostate cancer has no symptoms, how do we detect it? And typically it's detected on a routine physical examination with your physician or other healthcare provider and through a blood test. The physical examination is typically done with a rectal examination because prostate cancer tends to develop in the outside of the prostate rather than on the inside of the prostate. And when we do a rectal examination, what we're feeling is the peripheral zone of the prostate, and that's typically where prostate cancer develops. This is in contrast to men that have difficulty urinating. What we see is a development or an enlargement of the transitional zone of the prostate or the inner portion of the prostate. When we do a rectal examination as a physician, we're interested in trying to determine the size of the prostate because the size may be associated with some urinary symptoms, but we're also trying to determine the contour of the prostate and also the consistency of the prostate. Typically, when you feel a prostate nodule, you feel a hardness that develops in the prostate, and indeed, that can be suspicious for the development of a malignancy. We also use a blood test called the prostatic specific antigen, or PSA. This is a protein that's released from the prostate that's non-specific for prostate cancer. The PSA, this protein, is released in men that have an enlarged prostate. It's released in men that have an infection in the prostate. It's released in men that have prostate cancer. And it's also released in men after manipulating the prostate, such as passing a catheter or a cystoscope into the bladder in individuals. One might say, when I go to my physician, should I get my blood test done before my physician does a rectal examination because manipulation may alter the PSA? And indeed, this was looked at actually at Washington University in St. Louis. A very nice study was done that showed a rectal examination had no effect on changing PSA levels in individuals. We used to think that the PSA cutoff for individuals was 4, but we now know that the PSA is related to age. So men that are 40 to 49, the PSA should be between 0 and 2.5. Men between 50 and 59, the PSA should be between 0 and 3.5. Men between 60 and 69, the PSA should be between 0 and 4.5. And men 70 to 79, the PSA should be between 0 and 6.5. So if a 69-year-old individual comes in and his PSA is 3.5, that's a normal PSA for that given individual in that age group. If a man comes in that's 75 years old and his PSA is 5.5, that's a normal PSA for a man in that individual age group. So age is extremely important in understanding, PSA and what PSA can tell us. We also look at the change in PSA over time, and we call this PSA velocity. What is the change in the PSA reading from one year to a next? And indeed, if the PSA velocity is greater than 0.75 nanograms per milliliter per year, that's considered an abnormal PSA velocity. So as a physician, we use the PSA value itself, the total PSA, and we also look at the PSA velocity. What is the change in the PSA over a year's time? And both of these factors combined with the digital rectal examination would lead an individual to have or be considered for a prostate needle biopsy and ultrasound. So we use these tests to help us determine which individuals have an abnormal PSA and should undergo a biopsy for the detection of prostate cancer.
On this field, a single decision can change a game. For a man with prostate cancer, a single decision can change his entire life. I chose surgery, a less aggressive approach called active surveillance might be the best choice for you. Ask your doctor about a genomic test that may help you make the right decision. Learn more at yourprostateyourdecision.com.